Mr. Sosa is the first patient in South Texas, and he's among the first actually in the country to receive a double lung transplant after having complications with COVID-19. I'm Shelley Koffler from University Health Communications Department. First, just a little background before we talk to Mr. Sosa and our doctors. Mr. Sosa is 39 years old. He's from Corpus Christi. He entered a hospital in Corpus on July 4th with complications from the novel coronavirus. He was then transferred to San Antonio when his condition worsened, and he was evaluated by our transplant center based here at University Hospital. On October 22nd, our lung transplant team performed the surgery that gave Mr. Sosa 2 lungs from a deceased donor. Last week, nearly 5 months after entering a hospital, Mr. Sosa was able to go home. And I know you had a big smile on your face that day. It was a good day for you. We're going to be taking your questions via text messaging after talking briefly with Mr. Sosa and also his doctors who have been instrumental in his treatment. They happen to lead our lung transplant program. You will be texting your questions to 210-854-0291. That's 210-854-0291. Please provide your name and your media organization when you text your question, and I'll repeat this information when we're ready for questions. But first, as I said, we're so thrilled to have Jose with us here today, and we're so happy that you've had such a rapid recovery after your transplant surgery. So I'm going to sit down and talk with you a little bit so people can look at you and hear what you have to say. I'm wondering if you could just tell us a little bit about your long journey, where it started, and the fact that you're 39 years old, you were healthy when all of this started. Tell us about your experience.
Oh, it was a long experience, I'll tell you that much, very long. As far as I know, I don't know certain where I caught it from. It may have been negligence on my behalf, maybe not enough hand washing, maybe too close to somebody, and it's basically where it all started, and I wound up in the hospital for it.
What kind of symptoms did you have that led you to go to the hospital and then to seek care?
I believe it started with the shortness of breath is that I started noticing, because I needed a fan to be right there on me to kind of get that air. Then I just started getting all the other symptoms, the diarrhea, the joint pain, the loss of smell and taste was definitely a real one, because I noticed right away that I couldn't smell anything no more. Things strong like perfumes and colognes, couldn't smell it. Just the headaches started coming on too. So basically everything that they put out there, I experienced all of them.
And you're only 39 years old. Did you have any underlying conditions that you were aware of?
Not that I was aware of. Didn't even really find out that I was kind of slight diabetic until I came to the hospital too. So, I probably did have an underlying condition, but was never aware of it.
This is obviously physically debilitating, but I can only imagine this must have been very difficult to deal with as well, emotionally, for you and your family and friends.
Oh yeah, it was, especially at the beginning when I found out I was going to have to be in the hospital for a while. And then at the point when they told me, Dr. Levine and Sosa told me that I was going to need a lung transplant, that kind of hit me a little hard there. Kind of left me speechless for a while. Dr. Levine knows. It kind of left me speechless and thinking and wondering, what's next. And I didn't really get the gist of the feelings until when I was in the physical therapy part of it, knowing that this was the home stretch to get home. And that's when all the feelings of those 5 months just kind of came all at once and hit me there. This is when, I guess it was just that feeling that I knew I was going to go home and everything was winding down. So that's when it kind of hit me the most about everything. All the feelings came in. So
when you were transferred to San Antonio, you knew this was more than just something you were going to get over in just a week or two.
When I first entered the hospital, I thought it was going to be something short. You hear on the news of people just having the sickness for about 2 weeks and they get cleared of it and they go home. And that's what I was thinking of. But until I got transferred here, I was unconscious when I got transferred here. So I didn't probably wake up to like a day or two later, found out that everything else was wrong. I think I woke up already on Ecmo. So that's when they started talking to me and telling me about my lungs and stuff like that. So.
And Ecmo is a very serious procedure that's used to help people who can't breathe. And Dr. Levine is a pulmonologist, so when we get to her, she can explain a little bit more about what that does and why it helps people. But you had to make a decision at one point about a transplant, and I think you told me earlier at first you weren't interested.
Well, it wasn't the fact that I wasn't interested. I mean, I wasn't. It's just that I never thought I would have to. I didn't know this was going to take me there. You know, if I don't know if it was already underlined and it just attacked what was there already. You know, maybe somewhere down the line I probably would have had to have a transplant. I don't know. I don't know the health of my lungs before I came in, or did this just start when COVID hit me? So there's no telling. I don't know. I'm not the doctor. These are the guys are the specialists right here. So I just know that it was a surprise to me. And I don't think I didn't deny it at first. It's just it hit me so hard I just couldn't like answer the question right away because
Sure.
It was all just kind of sudden for me. So
it's a lot to adjust.
It was a lot to think about and adjust and stuff.
I know you said you wanted to be part of this press conference today in part because you have a message and you want to speak to the other people in our communities about COVID-19. What is your message? What do you think everybody needs to hear?
Quit pretending that it's fake. It's a real thing. Protect yourself, protect your family. Stay away from as many people as you can that are not in your immediate household. Wash your hands, do whatever you can. Protect yourself because it's not a joke. Like I said, I probably was negligent on my behalf because maybe there was a part of me that didn't believe, that just how serious it was until it got to me, until it put me where I'm at right now. And it really opened my eyes. Like I said, laying in that hospital bed for that long really brought all these thoughts and feelings out and, how could I have done things different? But at the time, it wasn't in the clear. Things started opening back up, so I just needed to get back and work. My day job was still going during the whole Corona thing, but like my nighttime job, getting that extra money and stuff that I needed to support myself and my family, I needed to get back there right away. So like I said, it was negligence on my behalf because where I work at is a lot of people.
Where do you work? Because I think our reporters may be interested in knowing. You have a business of your own, but then you also have you have a primary job.
Well, the primary job was at Gill Garden Center in Corpus Christi. I sell plants and stuff like that and give guidance at a nursery in town, and at night just doing some DJ gigs.
You're for private entertainment?
Private entertainment, bars and stuff like that, yes, ma'am.
Okay. Well, thank you for your message, and I know we're going to have some questions from reporters. They're going to want to hear more about what comes next for you. But right now, we're going to talk for just a few minutes with Dr. Edward Sacco, who led the team that performed Mr. Sosa's transplant. He's on faculty at UT Health San Antonio, and he's the surgical director for our lung transplant program at University Health Transplant. Dr. Sacco, let me just ask you, what was the process for evaluating Mr. Sosa? And I know that this is a very serious kind of operation. Not every patient is equipped to do well with this transplant.
Well, yes, we have a pretty standardized protocol for evaluating potential candidates, just like for all of our patients. It essentially looks at making sure that all other organ systems are functioning well, kidney, heart, liver, that sort of thing, that there's an absence of any ongoing infection or malignancy. And in our program, we really like to see patients be fairly mobile still. And so for most patients, it's not a big problem, but for patients such as Mr. Sosa who are on Ecmo and in a hospital, in an ICU setting, that can be quite a challenge. And I would like to acknowledge the work that they did at Methodist Hospital, our colleagues there, the Ecmo team and the COVID team, in treating his acute illness and getting him stabilized, and then the hard work of getting him essentially reconditioned as far as moving up and around. If you had seen him as we were evaluating him, he was up and walking around, doing essentially laps around the unit, and so those made him a particularly good candidate for this type of procedure. And then the things that we look at for social support and compliance with the medical therapy, all the things that he showed us that he could do.
And I think I've heard you say that he did not have a lung condition that looked so different from the lungs of other patients for whom you've done lung transplants.
Well, no, in the sense that it was clear that his lungs were not functioning and he needed this extra support to maintain himself. The one thing that's a little bit different about this particular situation, and as we're learning on a constant basis, one reason it took so long was what were his potential for recovery. And it's not something that you know one day to the next, but it became clear over the course of time that he was not going to recover from this. That was primarily respiratory failure only, and that's how we came to the conclusion that he would be a good candidate for lung transplant.
Okay, let's bring in Dr. Debbie Levine now. Dr. Levine is a pulmonologist on faculty at UT Health San Antonio. She's also the medical director for our lung transplant program. And Dr. Levine, as a pulmonologist, you treat respiratory conditions. So this is something that you're very familiar and knowledgeable about. Can you tell us about Mr. Sosa's case and why a lung transplant became an option for him?
Well, I think a lot of it is analogous to what Dr. Sacco has talked about. When Jose came in, he very likely did not have the lung disease that we saw on the CAT scan or on the chest x-rays as he progressed. And he was on the ventilator for a while, and when he could not oxygenate and ventilate appropriately, he had to be, he had to go into a more advanced therapy of ECMO. And while he was on ECMO, again, he really was awake and getting stronger, but he was still unable to be liberated from that tool or that machine.
Can you talk about what ECMO is for our journalists who may not be familiar?
Yes, so ECMO is many patients who require, who either progress from this lung disease or others, may not get enough support from mechanical ventilation, where a patient is intubated and maintained oxygenation and ventilation while on a breathing tube. Oftentimes, patients that isn't even enough support. Patients may not be able to keep their oxygen levels up or get the CO2 removed from their lungs and may need even more. So this machine is a way that you can actually oxygenate and ventilate by mixing oxygen with the blood from an oxygenator. So it's actually, the patient isn't even needing to be intubated. The patient is probably off the ventilator in many cases. In Mr. Sosa's case, he was able to come off the ventilator and be just on the ECMO machine and able to eat, walk, talk, and, really get stronger. But at some point, you see the CT scans, you see the x-rays, you see the progression of disease, and you see the inability to reverse the disease process. And at that point, really there's no options available except possibly a lung transplant.
You're very involved in professional organizations throughout the country, and I think maybe even globally. And so you're talking to your colleagues elsewhere who are evaluating these kinds of situations in patients. Do you anticipate that COVID-19 is going to lead to an increased need for lung transplants?
I think there's two types of situations that patients may require lung transplant after COVID-19. And one case is like Jose's, where acutely they progress very quickly and cannot come off either the ventilator or the ECMO. These patients may go from a critical care ICU, as he did, right into a lung transplant, which is very different than how most patients maintain a lung transplant. Other patients can go home Maybe they've gotten some lung disease. They may have been on the ventilator. They may have been on ECMO. They may have been on neither, but their lungs do progress and have some destruction that at some point that disease may progress or just may not get better. But they're able to get off the ventilator, rehab, and at some point go home. And at some point, they may still be on oxygen and still may require a lung transplant after some time. So those are the two kind of ways that patients may require lung transplants after COVID-19.
And I think I've heard you talk about, and something Mr. Sosa may want to react to, and then we'll go to questions, and that is when you are faced with an acute situation and you have to make a short-term decision, you don't have time to think about a transplant process that information for 6 months or 8 months. It happens so fast. That's very challenging for your patients, isn't it?
I think it's probably the most challenging, and I think there's Jose said when he came here to San Antonio, he was sleeping, and he didn't wake up till he was on ECMO. And then to have us come in and discuss with him, oh, now you need a lung transplant. When patients see us in clinic, oftentimes they see us for weeks, months, and sometimes years. They've had time to discuss with their family, prepare their life to undergo such a life-changing event. So this is quite different, and like Jose said, and he'll talk about maybe a little more about how that was when he really was in rehab, when he started to really think about everything that went on.
Is that hard to process, Jose?
Not as much as it was when I first found out. Like I said, I catch myself thinking when I'm at home laying there and stuff like that, when there's nothing more to watch on TV. Just turn off everything and just kind of listen to the quietness and just reflect, really, not dwelling. It's more like reflecting about, the past 5 months. And just, just thinking over everything I experienced and stuff like that. So, and it's not painstaking or nothing like that. I mean, like I said, I'm blessed to have gotten these lungs and get to live a life, take care of my family and stuff. So I think I'm doing a lot better on it. So.
Awesome. I think we have a good baseline for what happened here, and so this is a good time to take your questions via text messaging. If you haven't started texting already, the number is 210-854-0291, 210-854-0291, and if you would, please give us your name and your media organization. And I don't know whether we have any questions yet. Elizabeth said we don't have any yet, but we're happy to take your questions if you'd like more information from Mr. Sosa and from the doctors. While we're waiting to see if we have any text questions from the reporters, I think we've heard people talk about the need for a support system. Who has helped you get through this?
My girlfriend. She's like I said, been my rock since the whole time. She's been taking care of things that I should be taking care of when I'm working, but I can't. And she fully stepped in and took care of all that, and still managing everything right now till I slowly get back into the steady of everything. She's been there, and I'm grateful for that. Of course, she got her mom and stuff like that for letting us stay there during this time until we get back on our feet and stuff. So, just that whole family right there, I'm grateful for.
The other day when I spoke with you, I said, and this sounds like a cliche question, but what was the first thing you wanted to do when after 5 months in the hospital you left and you could go home?
I wanted to eat some real food. Not that the food here is not real. I just thought that the food here had a taste, and I thought it was meat, like the food. And when I actually got out, I went straight to Whataburger and got me a nice juicy hamburger, but found out that the taste was still there. It wasn't. It was the medication that's giving me this off-put taste, but it was still good to have that good meal that I hadn't had in a while, something I had missed. A little unhealthy, but hey, I think after 5 months I deserved it. So, and then after that, wanted to go lay in my king-size bed, memory foam bed, so that was quite enjoyable. So
just the simple pleasures,
just
right?
the simple pleasures, of course, to see the family and stuff like that. So, well, just the family that I'm staying with right now. I haven't seen the rest of my family quite yet because they live in Corpus. I'm located right now in George West, so just to kind of stay away from the bigger city for now.
Yeah, well,
Kinda.
it's wonderful you have such great caregivers, and that Ashley, she's obviously your big support system. So.
Oh, yeah.
I think we have a media question.
We do. This one is from Chelsea Torres at Chris 6 in Corpus. It's for Jose. Do you know how you got the virus? How are you feeling now? And are you back home, and what have you been doing? So I guess we'll start with, I know you've already addressed it partly, but do you know how you got the virus?
Like I said, there's no telling exactly where I got it because, I was going to the store. Most of the time I was covered in my mask, but still that's not 100%, especially if you don't wash your hands or something like that. Just one mishap, that's all it takes. So there's no telling exactly where I got it from. The next question was?
How are you feeling now?
I'm feeling good, getting stronger every day, less wobbly while I walk, I feel better. Like I'm getting there. A lot better than when I was in the hospital, so.
And again, if you just reiterate, because I know you mentioned it, she asks, and then one more question from Chelsea Torres. Do you know where the transplant came from?
No, I don't know any donor information.
All right. The next one is for you also, Jose. It's from Lauren Karuba at the Express News. After everything you've been through, what is it like to watch Texas experience a second surge?
Sad, honestly. Because like I said, there's still a lot of people out there that just don't believe or they just don't take anything serious. Everybody thinks they're Superman, untouchable and stuff like that. Believe me, it's not true. It can happen to anybody. I never thought it would happen to me, but here I am in front of everybody saying, be careful, protect yourself, protect your family. It's real.
And also from Lauren, can you talk about what your physical limitations are now and how the transplant has impacted your day-to-day life?
Just slight limitations. Like I said, every day I'm getting myself stronger. I think the only really support that I need is just to get in and out of the bathtub. That's it. And I walk freely. I started cooking on my own yesterday. And so, you're only limited to the boundaries you set for yourself. And I want to break through that. And I'm breaking through it, so.
She also mentioned that I know a lot of transplant patients have to cope with immune suppression while the pandemic is still ongoing. Does that bring other issues into it?
Oh, yeah. Well, right now I'm just staying isolated at the house. I don't get down nowhere. I don't leave quite yet, until the doctors say when it's okay that I can. I obey what they say. These are the professionals. And they say, hey, stay away from people, I'm staying away from people. I listen, so I'm not trying to do this all over again. Don't know if there's going to be a third opportunity,
And this question is from Liz George. I don't have the outlet, but she's asking if she could get the response in Spanish.
I don't know Spanish,
Okay.
I'm sorry.
That's all right. She says, do you think at any point that you'd end being transplanted? I think at any point did you hesitate, decide maybe you didn't want to?
The only thing I had a doubt about, I think you were talking about the Hep C, right? The lungs maybe possibly having, or something along the lines like that. I know that at one point I was uneasy about that. I think I was talking to Dr. Sacco about it, and I was kind of uneasy about it. I kind of didn't want that, but they were like, well, if you wait for clean lungs, it may take a while.
I think Dr. Levine has
So
some
there's,
comments.
throughout the country, there is both livers, hearts, kidneys, and now lungs, the ability to treat Hep C after a lung transplant if a patient allowed the ability to take a Hep C donor lung. And We didn't need that in our case here, but it is an option at our center as well as many centers throughout the country.
Okay.
Dr. Levine, on that same question, we have a dearth of lung donations, don't we? I mean, we have a very limited supply.
I think that donor lungs have always been farther between than other organs. Yes, we do have lung donation as well as lung transplants are exponentially lower than liver and kidney transplants, and that's because the lungs are very fragile and may have a difficult time getting all the way through to procurement and transplantation.
And lastly, from Liz George, if you could sort of briefly redescribe what was your life like before COVID-19, family, work, etc.
It was fun. I was, living normal life, working my job, taking the kids downtown by the water and skateboarding and skating, and, I was living a normal life. Having fun here and there, go out for a couple of drinks. But, now everything's changed, but a normal life up to that point, so.
We didn't ask you, but you have 3 children?
A total, combined with me, actually 5.
Mm-hmm.
But 2 for myself, 3 for her.
A lot of teenagers.
Most of them are already all teenagers. The littlest ones are already in their preteens, so no small ones. All of them are already trying to be adults.
That's the way it goes.
Yep.
Chelsea Torres has a couple of more follow-ups. How long was Jose in the hospital?
I think he was admitted in August or?
No, July 4th.
July 4th, and then all the way up until his transplant.
Till December 2nd, I was discharged, so about 5 months.
Do the lungs feel different?
No, I mean, it feels a part of me, just adjusting to them and my breathing and stuff like that. But, I mean, I feel like the same person, just.
One of the things about Jose is that he really worked from day one very hard. He has enough grit for all of us put together to get to where he is now. Once he was out of the transplant and out of the ICU, he worked so hard to get to be able to go home in rehab as well as now. He had his first clinic appointment today, and his lung function is much more improved than even when he left the hospital in 1 week.
So that's a process.
It's a process, and he's kind of above and beyond what he was doing in the hospital. So it's all him.
Very good. For the doctors, how long did the transplant take? And how long did it take to receive the transplant? I guess, is there a waiting time and a surgery time?
Dr. Sosa, you might be a good person to answer.
Well, the waiting time is dependent on donor availability, I believe. And there were some fits and starts, even when we had done the workup and agreed to put him on the list. There was a period of time when he had an infection that we had to temporarily suspend his eligibility and then reinstate him. And so that was a very up and down period for all of us. I think all told is about 2 or 3 weeks from the time that he was listed until we actually were able to transplant him. The operation itself was about 5 or 6 hours. It wasn't, fortunately for us and for Mr. Sosa, it wasn't that different than most of the transplants we do. We were led to believe from talking to other centers that in some cases there can be pretty extensive scarring that really lengthens the time it takes to do the transplant. But in his case, he didn't have much of that, so we were able to do it pretty much like we do most of our others.
Chelsea has one more question for Jose. And how does it make you feel to know you have this second chance at life?
Like I said earlier, blessed. I couldn't be grateful enough for the team, Dr. Sosa and Dr. Levine. Like I said, there's not enough thanks to give, and like I said, I feel very blessed and thankful, grateful, anything else I can think about. I'm just, as you kind of say, I'm happy to be alive, honestly, for not just, for me, but for my family, my kids, stepkids, and everybody else, for the rest of my family. Just happy.
See if we've got any others here.
We'll give the telephone number one more time if you want to text. To text your question, it's 210-854-0291. 210-854-0291. Please give us your name and then tell us where you work. Tell us about your media organization.
I have a question. Is there an average wait time, or is there no average patient for a lung transplant?
No, there's not really an average, but when patients are sick in the ICU or they're on the mechanical ventilation or Ecmo or on a lot of oxygen, they are their score is higher, so they might get the donor sooner than a patient who may not be as sick. So Jose was always very high up in our region to look for a donor.
I think I've heard either you or Dr. Sacco say that the waiting list for lung transplants can be, 5 years? Or, what is...
I think you, if a patient is put on early, it could be. Most patients are likely transplanted probably within a year, depending on what their score is. Patients who are have a very high score or very severe or have an acute disease, usually within a month and sometimes much shorter.
Dr. Levine, where are we now in terms of evaluating other patients and seeing the potential for more transplants for patients who've been damaged by COVID-19?
I think we all, and when I say we, I mean all lung transplant centers are seeing more and more referrals, at least to evaluate to see, hey, is this patient someone that would benefit from a lung transplant? I think we will be seeing more. I think maybe some of those will be maybe some of those patients that left the hospital but have to come back to clinic. So may not be so sick as Jose was in the ICU, but able to go home, but with some destruction of the lung that may require still some more support, maybe at home on oxygen. And we're seeing those patients now already, probably from the first surge. And I believe it will probably be progressive after this as well.
Do we have any more questions, Elizabeth? No more questions.
Well, I think we can wrap this up by giving Mr. Sosa the final word. You have been so gracious to sit with us for this morning and to give us your message, and then also to also tell us a little bit about what you've been through. Is there anything else you'd like to add?
Like I said the gist of it. Just quit pretending it's not real. It is. That's all I can say. Honestly, that's all I see is people just careless, still walking around with no mask, still within 6 feet of each other, in each other's faces, and it's scary. After this lung transplant, and like you said, my immune system being down, I'm more watchful than anything now. Like I said, and I look at everything around me now and just like, man, this could be you. Just be careful. Don't go down that road. Protect yourself, protect your family. That's all I can say. Just be careful out there. It's real.
Well, your message
COVID.
is a really important message, and we're hoping that people all across Texas and elsewhere are listening to this, because we know we're in a really critical period.
Yeah. Oh, yeah.
So just a few notes for the media out there. The videotaped recording of this press conference and some of the information about our participants will be available on our website. Probably within a few hours, we'll turn this video around and we will post that so it's available to you. You can review it if you'd like. And our website is universityhealthsystem.com, universityhealthsystem.com, and there's a section there that is designated for news, and you'll find our information there. Again, we want to thank you so much for sharing your story, and we want to thank Dr. Levine and Dr. Sacco for giving us some perspective about how the coronavirus, COVID-19, is affecting patients and leading some to require organ transplants. And I think that ends what we have here today, other than we hope you heard the message and that you can help us spread that message about the need to wear masks and practice good safety measures as we see the coronavirus numbers tick up. So thank you for helping us reinforce that good information. Thanks, everybody.